We're supposed to wash our hands. We saw the new campaign there. Do you think there's enough information out there, first of all?
I think there's a lot of catch-up. So given that China had this starting in January, and we knew it was going to come our way, I have a criticism for the government where we should have been educated before it struck the UK. So now it's getting better, we're getting more information, but even now there are people who don't realise that surfaces are quite a bad thing to touch.
Because it's all a bit about hands, hasn't it, rather than...
It's been about hands. Boris Johnson washing his hands for 20 seconds.
Yeah.
As somebody said, he manages to wash a lot of things out of his life. But
right. Let's not get political. In terms of this number, though, this 111, I mean, you know people that have been sort of turned away when they're found.
I suppose I entered it myself personally by trying to help patients last week.
Yes.
And when I rang 111, first of all, it takes 30 minutes to get through, which is difficult for a lot of people. And then I had two patients. One had come from North Italy, one had come from Africa, and both were refused testing. So at that point, I became interested to know what actually was going on, and there is not enough testing even now. That has not changed.
The NHS says 17,000 people have been tested for coronavirus in the UK. They talk about the 111 line. There's the online version as well. They say there have been problems, but people can still get through. Just about masks as well. The advice on this seems to vary. Should we be wearing them?
I don't think so. I think we can protect ourselves without masks. I think we should wear gloves. I think that everybody should have a pair of gloves that they can then wash in the evening. And I've been given, from a top virologist, sufficient satisfaction to know that washing is enough at night. So you don't want to touch a shared surface if you can help it. That means lift elevator buttons, the loo lever, door handles. Masks, maybe, but most of the masks don't protect you well enough. So it may stop you touching your face if you've touched a surface or had droplet spread on your hands, but it's not a particularly effective way of doing it. Maybe wearing glasses is a good idea. We've got a lot of droplet spread going to the eyes. And I think that we have a real problem with contact lens users, which nobody's talked about, because you should really wash your hands enormously before you put your lens in.
Yes.
And then maybe wear glasses in the day or sunglasses.
On the mask issue, here is the latest advice today from the Deputy Chief Medical Officer.
For most people, actually, they tend to get a mask, and it's a behavioural issue as well. They put it on, they take it off, they'll perhaps put it down somewhere where they'll get the virus and put it back on again. And therefore, in some ways, they may actually risk catching the disease rather than preventing it. So routinely, we don't recommend them.
Let's move on to what's happening in the workplace. The Prime Minister announcing emergency new measures today.
If we ask people to self-isolate, they may lose out financially. So I can today announce that the Health Secretary will bring forward, as part of our emergency coronavirus legislation, measures to allow the payment of statutory sick pay from the very first day you were sick, instead of 4 days under the current rules.
Gavin, some clarity from the Prime Minister saying what he said today. Do you think it goes far enough?
I think it's a welcome change, but we don't think that it's gone far enough. The core problem here is that people who are on low incomes and 0 hours contracts may still feel financial pressure in order to come into work when they should be taking the cautious approach and following the advice, are not coming into work. And that's because some people don't qualify for statutory sick pay and some people can't take the drop in income that would mean.
And if, 0 hours, it's still not clear, is it? You would want to self-isolate as soon as possible, and yet you could be in hardship if you do that.
Exactly. Look at this from the point of view of a low-paid care worker, for example, who is on a knife edge in terms of their family finances, and they are being faced with a choice between following the advice and perhaps having to come into work. We think they should be able to follow the advice, and that means that the government should be taking more action to help people, working more within employers, and perhaps even setting up a compensation fund to make sure that people don't suffer that financial detriment and feel pressurised into coming into work.
And your union has written to the government asking for this clarity.
Indeed. We've written to the Minister for Work and Pensions. At the very least, as an initial measure, we think that the qualifying period for statutory sick pay, the amount of money that people need to earn, should be removed. But we do think that the government should be working closely with employers in all sectors of the economy, but particularly those like the care sector, to ensure people don't feel that pressure.
And Jasmine, there are so many questions, aren't there? If you're planning a big event, I mean, we're at the contained stage at the moment. Do we have to wait until we get to the delay stage to sort of think about what might happen?
Yeah, there's so much uncertainty at the moment. So as you say, if you're planning something, you're wondering, will it be all right in April? Will it be all right in May? Nobody really knows. We're not getting very clear messages from anybody because they don't know. But what we do know is that a whole load of organisations have closed down their events. I mean, just some today, we heard more. The London Book Fair's gone, the Paris Book Fair's been closed down. Google stopped all its big meetings. Facebook has. I mean, I think it's about 260 events across Europe so far. Big events, thousands of people have been closed down. So this is going to be a bit of a nightmare for the insurers, really, because these, as I say, they're huge events. They have big insurance packages behind them, which are spread across various different insurers. But it's like having, an international disaster, really, for the insurance companies.
And in a situation, so we get to a situation where they say, large gatherings are banned. I mean, you'd be able to cancel things like weddings, perhaps, and would that mean you'd get compensation? I mean, if the government is saying you can't have gatherings.
Well, that's a very good point, and that would be something to consider with insurance. I mean, you can get wedding insurance, some people do, but if you don't have insurance, and as you say, if the government has said you may not have this level of gathering, then the insurers would be looking to the government to give the compensation rather than themselves. It's a whole conversation that needs to happen, I think, at government level.
And even the Bond film being moved, I mean, perhaps not a good sign that something as big as that is being moved.
True. It also shows how dependent Hollywood is now on China, because it's not so much us, it's the Chinese bookings that they're concerned about. So it shows, I think, again, with luxury goods, for example, companies that do luxury goods, they're being really hit because Chinese are not coming over to Paris, Milan, London and buying it up. So those, I think, we will see having a problem with their share prices soon.
And Dr. Ali, I mean, yesterday the Prime Minister spoke for an hour on this. There's lots of information out there, but do you feel from people coming to you into your surgery that people are getting more nervous, more frenetic? Are the questions getting more and more,
I think
severe?
that knowledge is a great thing. And I think if we did a lot more testing through 111 and it was much easier to access, and this impinges on both the other speakers, if you knew that you were negative, you could then go back to work. In the end, it would cost the government a lot less. If you knew that the spread had not progressed as much as you thought, you might continue with your wedding. And I think the uncertainty of not being able to test is causing the problem of panic. And I think the government really needs to roll out drive-in clinics, which at the moment there's one in London, impossible to access. And if they had that throughout the country, or they had pods that worked outside hospitals and people knew whether they were positive or negative, we could contact trace, we could monitor the disease, and we would really have a clearer picture.
Yes.
So they are uncertain because there's no knowledge, and therefore panic sets in. And ironically, if they knew more and knew they were positive, they would know what to do. So I think that coming back to the self-isolation for work,
yes,
it would cost the government a lot less if they poured money into the labs for testing.
It's a developing story. Thank you so much for all your insights tonight, panel. Thank you very much indeed. Thanks.